Hi, I'm Brian Lau. I'm with Sports Medicine Acupuncture, also with Jingjin Movement Training. I want to thank American Acupuncture Council for having me again. So today we're going to present on some therapeutic exercise, some Qigong exercises for the wrist and elbow. Maybe a little more towards the wrist and for wrist dysfunction. Some mobilizations and just range of motion movements for the wrist, but it'll also engage the elbow, and we'll look at the mechanics for both of those. So I have a presentation. We'll go through a little bit of anatomy and then I'll show some exercises. So let's go to the slides and we will jump right in. All right, so first of all, the wrist joint is also called the radiocarpal joint. That is a condyloid joint. So condyloid joints, you can see it on the right on that image. It's kind of a modified ball and socket joint. This particular joint allows for flexion, extension, and it allows for, depending on your terminology, you might say radial deviation and ulnar deviation. You might call those abduction and adduction too. But basically those four movements. So flexion, extension, radial, and ulnar deviation. So there's a decent amount of range of motion for the wrist joint. But then we can also look at pronation and supination that occurs at the distal and the proximal radial ulnar joint. So the exercises we'll be doing will be employing those ranges of motion of flexion, extension, radial and ulnar deviation, and then of course pronation and supination. Really, pronation and supination are key to proper functioning of that joint. So here's a little bit of an image that shows those. I'm sure everyone's familiar with these movements, but we have the normal ranges of motion. So for flexion and extension, normal range of motion is 80 to 90 degrees for flexion, 70 to 90 degrees for extension. So there's some variability, but you want kind of nearing 90 degrees. For ulnar and radial deviation, you have a little more range of motion for ulnar deviation. We'll look at the mechanics of why. So that's about 30 to 35 degrees for ulnar deviation, a little smaller range of motion, 15 to 20 degrees for radial deviation. And again, we'll look at the mechanics for that. And then for pronation and supination, we have about 90 degrees for both pronation and supination. So looking at the mechanics of the wrist. So the radiocarpal joint, there's less space. You know, your articulation is between the radius and the carpal bones. And there's a little bit more space between the ulna and the carpal bones. And there's a fairly complex structure, the triangular, Jesus, blank on the name, triangular fibrocartilage complex, sorry about that, is in this region. It's a collection of ligaments. There's a meniscus and a disc. So there's a lot of anatomy here that can get injured. That TFCC can become injured. There can be tears in the meniscus and tears in the ligaments in this structure. But there is a little bit more space, and that greater space allows for greater movement and ulnar deviation. So when we're doing radial and ulnar deviation, I just wanted to highlight a couple things with the anatomy here. Is that we can do a little manual work to help open up that range of motion. And in particular, we can come in between to the ulna, kind of between this fascial compartment that contains the extensors of the wrist, particularly extensor carpi ulnaris. We can kind of move that away and stretch that tissue as we're doing the radial deviation to help stretch that tissue. We can also come in at that space pretty much along the large intestine channel here between the extensors of the wrist, extensor carpi radialis, longus, and brevis. So we can kind of go in these fascial spaces and open those up while we're performing the motion. We'll look at that when we come to the actual exercises. We're going to look at a couple stretches for the wrist, and then we'll look at a couple more complex movements. So just so we have an idea with that, when we're doing radial deviation, we can go into this space and kind of move this fascial compartment away from the bone, move the extensor carpi ulnaris away from the bone and create a little bit more space as we're doing radial deviation. And same thing applies when we're doing ulnar deviation. I can come into the large intestine channel along the extensor carpi radialis, longus, and brevis, brachioradialis. This mobile wad of 3 is what it's called. these three muscles that are very mobile. I can get into that fascial space and kind of open up the compartments while I do ulnar deviation. So we'll look at that in context in just a moment. We can also work on the lung channel in that same kind of mobile WADA 3, but on the volar side of the arm, the anterior portion of the forearm, and open up that fascial space. So the elbow itself is a hinge joint that's going to allow for flexion and extension. We're primarily going to be looking at the wrist movement in this webinar, but we will employ some movement in the elbow, and it's going to be that flexion and extension. But there is also that proximal radial ulnar joint does pronation and supination. It happens at both the proximal and the distal radial ulnar joint. So when we're doing the pronation and supination, it helps link those motions. And it's the case that when I do supination, I can increase that supination by going into elbow flexion. So supination, I can go a little farther with elbow flexion. In pronation, I can go a little farther when I do elbow extension. So there's a relationship between the movement of pronation and supination with elbow movement, and we'll look at that in just a moment. So for pronation and supination, we have multiple muscles that perform those. For pronation, we have pronator teres, we have pronator quadratus at the distal part of the forearm, and we also have both the extensor carpi radialis, the flexor carpi radialis and the brachioradialis. Both of those help maintain a certain amount of radial deviation when I'm doing pronation. So especially some sources say brachioradialis more, some flexor carpi radialis, but they're both involved with pronation. For supination, I have the supinator, biceps brachii, and then the extensor pollicis longus of the thumb, so that helps pull the forearm into supination. So a lot of muscles involved with those beyond just the pronators and supinators. So that's the overview of anatomy. Let's look at some of the exercises. So I'm going to move back just a little bit. We'll start, I'm going to stay seated. We'll start with some wrist mobilizations. So the first thing we have is we can work on extension. So I'm going to bring my fingers together, index, ring finger, and the index finger. I'm going to put my middle finger on top, thumb and pinky together, sort of like holding something away from me. And elbow extension, I want to contract the flexors and stretch the extensors. So I want this to be somewhat active in the sense that I'm contracting the wrist flexors to be able to inhibit those extensors. I'm giving a little overpressure to stretch those. That's a nice stretch. If I want to increase that though, I can put my thumb inside and make a loose fist. Same thing, activate the flexors. That's going to stretch the extensors, and a little extra overpressure to be able to really stretch that extensor compartment. You can do that a couple times. Exhale, contract the flexors, overpressure, and stretch. Maybe do that 3 times. And stretch. So to stretch the flexor compartment, I'm going to turn palm up into supination, straighten the elbow, and same thing, I want to engage the extensors to help inhibit those flexors. So I want this to be an active stretch. I want to pull my fingers back, pull the wrist back into extension, exhale, and a little overpressure. Maybe for about 2 to 3 seconds. Then again, open into extension, pull the fingers back, exhale, stretch the flexors. One more time. So again, I'm active, engaging those extensors to be able to stretch the flexors. All right, so ulnar and radial deviation. So again, there's less range of motion for radial deviation. a greater range of motion for ulnar deviation. That's normal mechanics. But I would say that many people get restricted on that radial deviation part, and everything sits and lives a little bit more into the ulnar deviation. Think about typing on a keyboard. There's a lot of things that we would do that would kind of favor that ulnar deviation, and that can really compress and wear down that TFCC, that triangular fibrocartilage complex on the ulnar side of the wrist, kind of at the small intestine 5 region. So that would be a way I could go in with an acupuncture needle. I can kind of stimulate that area, increase blood flow at SI5. That's a really good point for that. But then at some point, I want to be able to stretch and open that side up. So I'm going to start with radial deviation. So I'm going to put if I have my palms together, I'm going to put my little finger side out, stabilize the wrist, and pull into radial deviation. So this is where I can do a little bit of manual work. If I want to help increase that, I can do it by just giving a little overpressure to go into radial deviation, but now I can go kind of along the small intestine channel right up against the bone, pushing the extensor carpi ulnaris away from the bone, pulling down. And as I pull, it'll give a fascial drag on the periosteum of the bone, on the extensor carpi ulnaris muscle. So again, move down, push the extensor carpi ulnaris away. So that kind of locks me down into the bone, and then radial deviation to give a little stretch. So I can work down. Eventually, as I go farther towards the elbow, farther proximal, I'll run into the anconeus muscle. Right about there is where I'm starting to get into anconeus. But my goal is really at that extensor carpi ulnaris. I can work more distal and work towards SI6, which is the border of that is the extensor carpi ulnaris, right there on the bone, and stretch. That's a part of the triangular fibrocartilage complex, is that extensor carpi ulnaris tendon. So it's nice to be able to work on the tendon sheath and start to loosen that up. Okay. Ulnar deviation, if I have a triangular fibrocartilage tear, that might be a painful motion, so I have to let pain be my guide for this, but for most people it's going to be fine. So I can stretch this way, but same thing. I can now go at the along the LI channel, kind of at the border of that mobile wad of 3, and I'm going over the thumb muscles, the extensor pollicis brevis and abductor pollicis longus. These are muscles that get injured with de Quervain syndrome. They can become very painful, especially when you go into ulnar deviation. Finkelstein's test would be just that, where you put the thumb in and oh, that hurts. That would be a positive for de Quervain's. So it's useful to stretch this compartment out. I'm going to kind of hold, and same thing, pull down, ulnar deviation. So kind of working over those thumb muscles and then following along that border of the mobile wad of 3 to be able to stretch. I'm going right up against the bone. So into that fascial space, up against the bone, pull towards the elbow, stretch. So this is something you could do with patients. You could also show them this as a corrective exercise. I can go also along the lung channel, pull down, ulnar deviation to stretch. So working to free that mobile wad of 3, to free the borders and help increase the range of motion into ulnar deviation. Okay, so last mobilization, we're going to do pronation and supination. So this one, I want to have my arm by my side because I don't want to be doing a lot of shoulder motion. So I'm going to use index finger, middle finger. I'm going to stand up a little bit so you can see this one a bit better. Back up. So index finger, middle finger surround the thumb. I'm going to use my thenar eminence to block the wrist on the ulnar side, wrap around. So I'm going to pull with my fingers, push with my thenar eminence, and increase supination. I can use my extensor pollicis longus to pull back. That's going to increase that supination. Lift my little finger, that'll increase supination, and overpressure. So index finger, middle finger, either side of the thumb, thenar eminence against the wrist, overpressure. Pronation, palm down, thenar eminence on the radial side of the wrist, wrap the fingers around. And this is the one that I really want to be cautious, not because it's going to cause injury, but I'm going to miss the stretch, not to lift my elbow because that becomes a shoulder motion. Not very challenging on the shoulder either. So I need to stabilize that elbow to the side and just do pronation. So same thing as I can bring my thumb down, little finger up, over pressure into pronation. Right, same thing, 2-3 times to start to increase that. Again, don't let the elbow come up because that takes the stretch away from pronation, brings it up into the shoulder, and it's not going to really do you much. So I need to keep that elbow up against the side, pronation. Right, so supination, pronation. All right, so let's look now at a couple Qigong exercises. I'm going to back up just another step. Move this chair out of the way. So this is a common one that I use in Tai Chi and Qigong classes, also on my own. It's a very simple exercise. It's actually built from standing meditation. So in standing meditation, you might have a shoulder width stance, sitting a little bit, dropping the pelvis, so letting the pelvis sink down. The head rises up, so there's a little bit of stretch in the spine, and I'm slightly engaged in the center. Round. So there's a round structure as if I'm holding a paper ball. My hands are open, fingers are spread out a little bit into abduction, and the wrists and the fingers are aligned. So that would be a typical standing meditation posture. When I do this exercise, I want to use that standing meditation posture. I want to have that little bit of a drop of the pelvis, a little bit of an elongation of the head. So kind of do 20 towards the ceiling, little bit of compression in the torso, and I have my shoulder blades coming around and very round like I'm holding a paper ball. So that's going to be the starting position, and from there I'm just going to rotate. So I want to keep in mind how the thumb and other structures are keeping that wrist aligned. I don't want to get too floppy with the wrists. So a lot of people, when they do this, they start flopping, they lose the pronation and supination. I want to keep that alignment there. Almost as if I'm going around my middle finger or my index finger, even better. So just turn, I can go slow, or I can go fast. Once you get comfortable with it, you can speed it up a little bit. And I want to just let that motion move the body. So I'm pronation, supination. This one you could do for about a minute or two. Just a nice warm up for the forearm. Starts really working the wrist and the elbow joint. Okay. Next one. It's going to be built from that. Same posture with the body. Turn the top palm out, reach out. Other hand comes in. So I want this one to move the rib cage, maybe a topic for another day, because there's a lot of diaphragm motion, a lot of movement in the liver and the spleen. But we're thinking about the elbow and the wrist, so I want to be able to fully pronate, turn the palm out, straighten the elbow. Other hand supinates, comes in. I can make this one slightly more round if I want, or I can reach out. Letting the shoulder blade come around the rib cage. All right, last one. So this one I actually did in another webinar with American Acupuncture Council. It kind of works on opening the chest up, but it also features that pronation and supination. So pronate, pull the chest open, straighten the elbow, reach out. Fully pronate. Chest rises, open. Open, turn the forearms, line the hands up, keep opening. Hands are slightly in front of the elbows. Pull the shoulder blades together, so this one starts really working in the chest quite a bit too. Fully press out, chest starts to compress. Back to neutral. Line everything up, fully open the chest. And finish. So 3 exercises, all part of a standing meditation, Yichuan type training. They're derivatives of that. First one's just rotating the forearms. Then the forearms rotate as I reach out, kind of mobilizing the rib cage, but it also gives a nice stretch to the elbow, stretch and challenge to the wrist joint, keeping good alignment through the wrist, and then opening the chest. And involving the elbow, wrist, and shoulder girdle. All right, so hope you find those useful. Those are great exercises to do for yourself, especially after a long day of work, last one in particular. But great for patients. I use those quite frequently for patients for a whole host of issues. We were looking today at wrist and elbow. Those would all be useful for those types of, many of those types of conditions. But that last one also very useful to open up the breathing, open up the shoulder girdle. So good for shoulder health. Any of those motions, if there's sharp pain or something discomfort, uncomfortable when patients are doing that, you have to let pain be the guide and modify it based on that. But they're very adaptive, easy to work with. Patients find them very useful. They're pretty easy exercises too with a little bit of coaching. So I'd recommend doing them yourself, get used to it, and then start working with those with patients. They're really nice exercises. So thanks again to the American Acupuncture Council. Always fun to come and to present some of this information. So I'll see you all another time.